Hi, I'm Lincoln Kincaid, founding owner of Physical Therapy and Balance Centers of North Central West Virginia. Today we're going to talk about foam rolling and knee pain. But before we go any further, I want you to take a moment, hit the red subscribe button tomorrow so you can get access to all of my videos, help you get out of pain and love your life. When we consider foam rolling, there are really three areas of the leg that we want to consider, and all of them are above the knee for foam rolling. We have an anterior zone that runs right down the top of the leg. We have a lateral zone that runs down the side of the leg, and then we have an intermediate zone that runs right between those other two areas. It's a little hard for you to see on camera, but I'm going to do my best to make it apparent. So when you're thinking about knee pain, it's a combination of flexibility, of strength, and soft tissue mobility. So foam rolling is one of those things where we address the soft tissue mobility, which can significantly help you decrease your knee pain. So the technique for this can be a little cumbersome to learn. So what I tell everybody is, we're going to start at your kneecap. We don't want to roll over the bony prominence of your kneecap. We want to start just above that. And I'm going to slide my leg down the foam roller about 3 inches. I'm going to come back up 1 inch. Down 3 inches, up 1 inch. So it's going to take me 1.5 to 2 minutes to do each zone on my leg. So I'm going to go ahead and speed this up a little bit, where I've done all the way down at this point to the top of my hip. Now, when I get to my hip bone, I'm going to roll over to that intermediate zone. I'm still supporting my body weight with this leg and with my arms. This is one of those things that's completely adjustable. If you feel like you need a little more intensity with the foam rolling, just put more body weight, adjust accordingly. So now I'm going to work my way back down to the kneecap, going 3 inches and 1 inch. Scoot up 3 inches, down 1 inch, up 3. I've got a sticky point right there, so if you get an area that feels like you need to address it, I like to slide back and forth or roll my leg back and forth to really help loosen that area up. And then I'm going to continue all the way till I get back up to my kneecap again. And then I'm going to roll straight over on the side. Now I'm still supporting myself with my arms and my leg. If you feel like you need to really increase the intensity, all you have to do is surf on the foam roller. Now I've got my full body weight going down through the foam roller, and it's very intense. Most people do not need that much of an intense foam rolling experience, because you can get sore and you might not do it tomorrow. So I would do this all the way back up till I get up to my hip. But I don't want to bore you watching me foam roll my entire leg. So there are literally hundreds of types of foam rollers out there. So you're going, which type is right for me? So what I use today is very, very low intensity foam roller. It's considered an open cell foam roller because if you look at the end of it, all of these foam cells are open as compared to what I would consider the next step up. These come in multiple lengths. This is 12 inches. You can get 18, 24, 36 inches. But really, a short foam roller is very good. I could have done what I just did here with the full-length open cell foam roller. I could do the same thing with this 12-inch closed cell. It's just a little more firm. And then I'm sure you have all seen these. This is a specific brand of foam rollers. They've got the different bumps and notches, and you do feel those when you roll over top of them. It will intensify the experience. So there is a lot of disagreement within the physical medicine world, within physical therapy, within physicians, other exercise specialists about what exactly does foam rolling accomplish. And I'm completely honest with people. The mechanism of foam rolling is unknown at this point, but I can tell you from personal experience it's very effective. I know for myself, when I start getting some crunching in this right knee going up and down steps, I use any of these 3 rollers at home for a week or 2. The crunching in my leg is completely gone. So when you start foam rolling, don't start with something that's really intense that you're going to be unable to maintain. So get a soft roller, start with that, and I recommend once, maybe twice a day. So we're looking at 5 to 6 minutes per leg to get a very effective stretch, and I can promise you within a couple of weeks you are going to see a significant decrease in your pain, allowing you to do all the things in life you really want to do.